everyone, so welcome to another video. So in the last video we talked about eclampsia, preeclampsia, and the different ways we can manage them, how we can stabilize the pregnant woman, how we can manage the condition. So today we'll be talking about another very common condition known as sickle cell disease. So sickle cell disease, this particular topic is actually very dear to me because I about about 7 years ago I actually lost my cousin to this condition known as sickle cell disease, and it was very tragic because she was in her final year of university. She was studying pharmacy. She was writing her final exams, and then she usually has her crisis, but this particular crisis, it came and it's never left, and it finally took her life. So whenever I find the opportunity, I try to give my 2 cents to this particular condition because I think it's something that everybody has to learn about. Everybody has to know the risk factors. Everybody has to know the things they should avoid. So this sickle cell disease, it is a hereditary blood disorder, and it is usually characterized by the production of abnormal type of hemoglobin known as hemoglobin S. So this hemoglobin is a protein that is found in red blood cells, which is responsible for carrying oxygen throughout the body. So when a person has sickle cell disease, their red blood cells become abnormally shaped, they become shaped like a sickle or a crescent, hence the name sickle cell disease. So it becomes abnormally shaped, and it does not look doesn't have the shape of the normal round red blood cell, the normal flexible disc shape. So this misshapen blood cells, they usually clump together, blocking small blood vessels. They break down prematurely, leading to chronic anemia, and they cause repeated episodes of pain known as vaso-occlusive crisis. Then they also lead to long-term damage in various organs due to reduced blood flow and oxygen supply to these organs. So this sickle cell disease, it is a lifelong condition that can range from mild to severe, and it usually requires continuous medical treatment. So looking at the background, this sickle cell disease, it is a genetic disorder passed from parents to children through a mutation in the gene that encodes the beta chain of the hemoglobin protein. So if both parents carry the defective gene, there is a 25% chance with each pregnancy that the child will inherit the disease. So historically, this mutation is believed to have evolved in regions where malaria was once common, because individuals who inherit only one copy of the gene, known as carriers or having sickle cell traits, are partially protected from severe malaria. As a result, the condition is more prevalent among individuals of African, Middle Eastern, Indian, and Mediterranean descent. So in Nigeria and other sub-Saharan African countries, sickle cell disease is a major public issue, and Nigeria has the highest number of people living with the disease globally. So basically, the breakdown of this sickle cell, how is passed from parent to parent, is that usually before a man and a woman gets married, they are told to go and check their genotype. So the genotype of a sickle cell patient is SS. It's usually SS, and Sickle cell often occurs when, for example, two carriers of the gene get married. Like, for example, there's SS, there's AS, and there's AA. So for me now, I'm AS. That's my genotype. So if I want to look for someone that I want to settle down with, I cannot go for. It's not advisable for me to go for someone that is AS, because there's a risk of us getting a child that has the sickle cell disease. So it is more advisable that if you are AS, you should go for someone that is AA. And if you are SS, it's more advisable you go for someone that is AA, because then your children will just be carriers rather than you passing it down. And then the complete worst is SS going for SS. That is usually not advisable. So that is how it's passed down. If when a carrier that is AS marries another AS carrier, and they give birth to a child that is SS. So usually people with the carrier gene, they are usually how do I put it? They are usually partially protected from severe malaria. So that's why you see people that are AS, sometimes they will tell you they can't even remember the last time they had malaria. And this is not even a joke. Even me, I can't remember the last time I had malaria. Malaria is not as common for people with the carrier gene than people that are AA. So most of the time, they are the people with AA genotype. They usually have more episodes of malaria than people with the AS genotype. So when we're looking at the signs and symptoms, so symptoms often begin to appear around 5 to 6 months of age, and it can vary in intensity. So common signs and symptoms include pain crisis, like sudden episodes of intense pain, usually in the bones, chest, or joints, caused by the blockage of blood flow. So then there's also chronic fatigue, chronic weakness due to ongoing anemia, then swelling of the hands and feet, especially common in infants. Then there's also frequent infections caused by the spleen damage, which usually filters blood and fights infections. The presence of jaundice too, that is yellowing of the skin and eyes due to increased breakdown of red blood cells. So most of the time, whenever you see these sickle cell patients, their eyes are usually yellow. And then there's also another sign is delayed growth and puberty in children, then vision problems or blindness due to the damage of the blood vessels in the eye, then also paleness of the skin, that they always look so pale, and paleness of the skin and the mucous membrane. So let's look at the clinical presentation. So looking at the clinical presentation, so in clinical practice, patients with sickle cell disease, they may present with repeated pain episodes, that is acute pain crisis. These episodes are very, very terrible, like they are very terrible. And then they present with symptoms of anemia, that is weakness, paleness, dizziness, then respiratory symptoms like cough, chest pain, shortness of breath, possible acute chest syndrome, then signs of stroke too, like weakness on one side, facial drooping, and slurred speech. Then also chronic leg ulcers can also be present, then growth delay in children, puffy hands and feet in children. So patients, they may also be brought in by their parents for fever, which is taken seriously due to the high risk of overwhelming infections. So looking at the etiology, that is the cause. So sickle cell disease, I've talked about this, is caused by point mutation in gene of the beta globin chain of the hemoglobin, leading to production of hemoglobin S. So this mutation results in the substitution of the amino acid valine for glutamic acid in the sixth position of the beta globin chain. So when deoxygenated hemoglobin S tends to stick together, polymerize, forming long rods inside the red blood cells that distorts their shape. So this distortion causes the red blood cells to become stiff, sticky, and fragile. So looking at the risk factors, like I explained before, having both parents as carriers of the sickle gene. So when both parents are AS, then ethnic background. So there is higher risk in Africa, India, and Middle Eastern population. Then having a family history of sickle cell disease too, because it's a genetic condition, it can be passed down. Then lack of genetic counseling or awareness in high risk populations. So not having enough counseling of how this condition can be passed down is also a risk factor. So when we're looking at the anatomy and the physiology, so in normal physiology, the red blood cells are round, soft, flexible, and it allows them to squeeze through small capillaries to deliver oxygen. So hemoglobin A inside the red blood cells hemoglobin A inside the red cells binds and releases oxygen efficiently. So normal red blood cells live about 120 days before being recycled by the spleen. So when we have the condition of this sickle cell disease, so hemoglobin S causes red blood cells to sickle under low oxygen conditions, and sickle cells are stiff and fragile, and they can only live for about 10 to 20 days, which is like the normal is 120, and then you have 10 to 20. It's not even enough. So these cells, they clog small blood vessels, blocking oxygen delivery because they are stiff, they are fragile. So they block oxygen delivery and cause ischemia and pain. So the spleen usually becomes damaged. The spleen becomes damaged over time, which impairs the body's ability to fight infections. So when we're looking at the diagnosis, before the diagnosis, when looking at the pathophysiology, so the key events in sickle cell disease: number one, the polymerization of the hemoglobin S under low oxygen conditions. Then the sickling of the red blood cells, causing shape distortion and membrane damage. Then we have vascular occlusion, resulting in tissue ischemia, inflammation, and pain. Then hemolysis, leading to anemia and elevated bilirubin levels, causing the typical yellow eyes and jaundice. Then we have end organ damage due to repeated episodes of hypoxia and inflammation. Then immune dysfunction due to the spleen damage over time, increasing the susceptibility of infections. So for the diagnosis of this condition, the diagnosis can be made at birth through newborn screening programs, or later in life based on symptoms. So diagnostic tools, they include hemoglobin electrophoresis. This usually identifies abnormal types of hemoglobin. Then we have sickling test, which is a screening tool that checks if red cells sickle under low oxygen. Then you can carry out complete blood counts, which usually reveals anemia with reduced red blood cells and hemoglobin. Then peripheral blood smear, which shows the sickle shape of the cells. Then we could do reticulocyte count. So usually it's usually elevated due to constant turnover of red cells. So reticulocytes are immature red blood cells. So it's typical for it to be elevated in sickle cell disease. Then genetic testing too can be done to confirm the mutation in the beta globin gene. So looking at the differential diagnosis, conditions that with similar symptoms to sickle cell disease that should be ruled out can include, for example, thalassemia. So thalassemia is another inherited blood disorder mimicking the same symptoms as sickle cell disease. Then we have iron deficiency anemia, autoimmune hemolytic anemia, lead poisoning, and osteomyelitis, which is bone infection, which can mimic the pain crisis that we see in sickle cell disease. So for the management or the approach considerations for this sickle cell condition, so the management we try to focus on preventing complications, relieving symptoms, and modifying the disease progression. So general supportive care, number one, hydration. So first we'll break it down. There's the general supportive care that we can give first, like hydration, which prevents sickling by maintaining good blood flow. Then folic acid supplements to support red blood cell production. Then regular monitoring to catch complications early. Then after giving the general supportive care, then pain crisis management. So usually for mild pain we can give paracetamol and anti-inflammatory drugs, but when the pain is severe we have to use opioids and intravenous fluids. Then we also advise for bed rest and oxygen to reduce the oxygen demand. Then the third step is preventing infections. So we can give vaccinations for influenza, hepatitis, then daily antibiotics, especially in children, to prevent bacterial infections. Then the fourth step, disease modifying therapies. So we can give hydroxyurea. So hydroxyurea works in a way that it increases the production of fetal hemoglobin and reduces sickling and pain crisis. Then chronic blood transfusions too, for stroke prevention and other complications. Then another disease modifying therapy that we can do is stem cell transplantation, which is a potential cure, although it carries risk and you have to find a donor that can match. So the fifth step is treatment of specific complications, like acute chest syndrome will require oxygen, antibiotics, and transfusion. Then stroke will require immediate care and long-term prevention. Then leg ulcers and joint damage, they may require multidisciplinary care. So looking at the prognosis, so usually with early diagnosis and modern treatment, people with sickle cell disease, they can lead longer and healthier lives. And prognosis, they have increased significantly with vaccinations and antibiotics, reducing childhood deaths, with hydroxyurea decreasing crisis frequency, with stem cell transplants offering potential cure. Then also with lifestyle monitoring too, which helps prevent complications. So without adequate care, the disease can cause early death from infection, from stroke, from organ failure. So with proper treatment, most patients, they can live up to their 40s, 60s, or even beyond. So that is basically it about this sickle cell condition. But usually prevention is better than cure, because sickle cell is a is a lifelong complication that you just have to always be taking medication, always be watchful. So it's just better that if you know you are a carrier, just just try to educate other people, like try to educate other people that if you are a carrier, don't go for someone that is also a carrier, so that you can reduce the um the lifelong implication on your child. You can reduce the pain that they will go through. You have to think about all these things. So that's basically it. For this sickle cell disease, prevention is better than cure, because it's a genetic disorder, and it's just better to avoid it if you know how to avoid it, than to just let it progress. So that is it about this topic, sickle cell disease. Thank you.